most people we've had in the audience since Avella.
Students.
Oh, yeah, I did. Yeah, there were those. Most people we've had in the audience.
Hey, you're. All right, well, I gotta keep this. It's been a while. Yes. Remember when we met my office? All right, well, you're the self, I always need to solve, I need lots of consulting. She's very pregnant, she is 2 weeks away from pregnant. Yeah.
So what vet do you go to?
So this is kind of hard, so I was very skeptical.
Yes.
I found this right,
Huh?
I think he started a couple times. Young guy, 6 o'clock. Yeah. Great. That's right.
I can think of this. Jay is here. Who's already working.
Yeah, I think this is.
2, 3, 4, 5. We got quorum.
You know, okay, so I was trying to get Sam on the photo 2 years ago.
All right, it's now after 6 p.m. The Human Rights Commission meeting for Wednesday, May 13th, 2026 is about to start. I can go ahead and call roll.
Please, thank you.
Chair Robert Marshall,
Present.
Vice Chair Christina Ballard,
Present.
Celine Coleman is not here yet. Joaquin Laura Midkiff.
I'm here.
Awesome.
I love the roll calling. This is great.
Let's see, I do not see Deanna DeCarmo. How about Commissioner Marys?
Here.
Commissioner Roche?
Here,
Uh,
I'm back in school.
Commissioner Rockenbrandt, and I do not see Commissioner Rosales. So we have 1, 2, 3, 4, 5. 5 of like 9. I think so.
Have you started the broadcasting, Chris?
Yes, I've already started broadcasting and recording.
Perfect. Awesome. Well, good evening, everyone. Thank you so much for joining us tonight for the Salem Human Rights Commission meeting. We'll go ahead and start with public comment. Are there any members of the public that would like to provide comment this time?
Commissioner Coleman is now here.
Did you receive any public comment online?
No.
Okay. All right, we'll move on to agenda item 3, member remarks and announcements on non-agenda items. Anybody have anything they'd like to add?
Off the top of my head, I don't know if I talked about this last time, but Partnerships in Community Living is doing an annual fundraiser, and they're looking for different donations and sponsorships and all of that because it goes to support adults with disabilities. So if anyone's interested, it'll be at Eola Winery sometime in the summer. I just don't remember when, June 19th, 18th, somewhere in there.
Thank you, Commissioner Roche. Vice Chair Ballard.
Thank you, Commissioner Roche, for bringing that up. I would just say it's really important for us to support PCL and other organizations that are supporting folks with intellectual and developmental disabilities right now. The federal administration is looking to take away their SSI. So we need to make sure we're helping those folks. Thanks.
Thank you. Anybody else? Seeing none, we will move on to agenda item 4A, the bias crimes update. And we have Lieutenant Lance Deedy from Salem Police Department joining us.
Good evening. My name is Lance Deedy, Lieutenant with Salem Police Department. So I'm filling in for Sergeant Robert Dowd. He was unable to attend this evening. So the first report I have two bias crime incidents to report on for the last month. The first one, a restaurant owner was reported receiving repeated phone calls at her restaurant by an unknown individual making racist remarks, including telling her to go back to her own country. Making derogatory comments about the food served. This was a Chinese restaurant. The harassment appeared ongoing over time with the caller using different numbers. The preliminary investigation identified possible association with a prior telephonic harassment case, so we have identified a suspect in this. No suspect contact has been made yet, but the officer is conducting follow-up and will likely either request a warrant for that person's arrest or make contact with that individual and make the arrest. The person does not live in Salem, lives quite a ways away. So we have identified a suspect in that. The victim in that incident was referred to the Oregon Department of Justice Bias Crime Hotline, as well as the standagainst.hate.oregon.gov, plus given that phone number. So that case is ongoing. The second case I have to report on is an individual reported being confronted inside a local area retail store by another patron who used racial slurs and made physical contact by pushing her with her body, with both her hand and a shopping cart. The suspect was described as an elderly female with possible mental health concerns. We only have a first name for that individual. That individual has not been identified. The suspect, the victim in that incident, did not wish to pursue charges and did not wish to be a victim. However, that victim was also provided with the same information from the Oregon Department of Justice Bias Hotline, as well as the standagainst.hate.oregon.gov plus the number. So those are the two incidents I have to report on this month.
Thank you. Are there any questions for Lieutenant? Vice Chair Ballard?
Lieutenant, can you tell me if the phone caller, were they sophisticated using like a spoofer for the numbers, or just, do you know?
We do know, yeah. We were able to conduct scans of the number, and it belongs to a juvenile male outside the city.
Oh, okay, because I
We've
think they use multiple numbers. And
Yes, but the multiple numbers all
all
go
led
back.
back. Okay, so they're not like.
no spoofing. Yeah.
Okay, okay, thank you.
Are there any other questions for Lieutenant Deedy? I have some questions for you, Lieutenant Deedy. You shared earlier that you also oversee the Salem Police Department's HST. And just because we do have some time on the agenda, I want to know if you might be able to provide just a brief update on what the HST is accomplishing. Know that it recently expanded to 7 days a week, and if you wouldn't mind just kind of providing a update on what they're seeing, the context they're having, and then what you envision for the HST program in the coming year.
Absolutely, I appreciate it. So as many of you have heard, Chief Womack retires on the 22nd, so a week from tomorrow. In his absence, Brandon Ditto will be stepping in as the interim chief for 6 months, and I've stepped into the deputy chief role for the investigations division for the next 6 months as well. So part of my roles and responsibilities with that job encompasses HST. We've got a lot going on with that team. So since we've expanded from 2 days to 4 days, we have 7-day coverage. So we are consistently making contacts, making referrals to local area service providers. The most recent data I showed a almost triple the amount of referrals in just the first quarter of that 7-day expansion. So the amount of contacts has gone up. The amount of referrals has gone up substantially, and so we're seeing some good benefit from the 7-day coverage. We're currently, there's two things going on. So we currently today just signed an an agreement with a local area construction company that is going to be assisting in cleaning up Wallace Marine Park. So there's large piles of trash that have kind of been left behind in that particular park. And this company is going to come in 2 days a month for the next 6 months, and they're going to clean a large portions of that trash out of Wallace Marine Park as part of HST. So we're seeing some kind of expansion into that park to get some cleanup efforts going on. And then we're also in discussions with ODOT about some of the camps that are on state property. And so that's a consistent problem we deal with here in our community is a lot of our property belongs to the state and so not the city, and we don't make contact in those camps. And so once those agreements are in place with ODOT, we'll be able to move into those camps, make contacts, make referrals, build relationships, and then also post those camps for cleanup.
Thank you. I have another question for you, Lieutenant Dede. What are some of the concerns that individuals experiencing homelessness are sharing with officers when they're going out and to those contacts and engagements? What are your officers reporting back?
So I think the number one thing we hear is relationship building. And so not every contact with a police officer, maybe because of as a result of arrest or a result of an investigation is always a positive contact. Well, with HST, they're consistently building relationships with individuals. They're on a first name basis with these individuals, with the officers as well. And so it's just building relationships. So you consistently hear from those in the unhoused community that are saying, I know Kevin, or I know Sean, or I know Jeff, and they know these individuals by a first name basis, and they're building that rapport and that trust. So eventually, when that rapport and that trust is built, you're seeing these people accept services at a quicker rate. We're seeing it at a more fast rate than we've seen in the past. And so that's kind of one of the things we're really working on as a team, is just making those relationships. That's really the goal of that team, is to get out there and be known, be seen, and when people are ready, giving them the opportunity to kind of get out, to work on whatever it is they need to work on, whether that be addiction or they're ready to be done and accept some services.
Thank you. It looks like we have a question from Commissioner Roche.
Yes. So my understanding is that the HST team focuses on downtown and northeast. Is there, as far as the ratio and how you are spending your time, there was some comments that I've seen, like, well, we've obviously seen crime go down in the downtown area, and just the difference in the response needed there versus out east. How do you guys manage when you go out east or when you focus downtown? If that's a valid question to ask.
Yeah, that's a great question. So the team meets every week, and in that meeting, we'll meet with the clean team for the city of Salem, and any complaints that we receive from the community, we'll evaluate that. So it's not just downtown, it's just not just Northeast Salem, it's citywide. So any city property we'll evaluate based off of that collaboration that we're having in that meeting, complaints that we receive, or camps that we're working on. And so we do primarily focus, we're just a 4-person team. So we're primarily focused in the downtown core, in Wallace Marine Park, and in Northeast Salem. A large portion of where we see some of the impact up north or in the Northeast Salem area has to do with the ODOT properties I was talking about earlier. So properties around Sunnyview, properties on Fisher Road, properties along the freeway. So we're not really in those areas yet until we have some of those agreements in place. But we try to go where we're needed. And so, but we are focusing on the downtown core, Wallace Marine Park, and then sections of Northeast for sure.
Thank you. Vice Chair Ballard.
Thank you. Since you've brought up Wallace Marine a few times, I do have a follow-up question, and I want to be clear in my intent as to why I'm asking it, because I think if there are any substantiations, that needs to be on the record. Recently, there was a news item about a high-profile individual in our area who made claims that there are dead bodies buried in Wallace Marine Park. Is Salem PD aware of anything that substantiates those claims?
I personally do not know of any information that substantiates those claims. I don't personally have a lot of information on those claims. I know that our investigative units in the criminal investigative section are aware of that. But as far as communication goes, I'm not sure where that landed.
Okay, thank you.
Are there any other questions for Lieutenant Didi? We'll take a question from the audience from Linnell Wilcox. You can go ahead and approach that desk over there.
I just wanted to compliment the HST team. I've been doing the community belonging surveys and we're talking to a lot of people outside. And one of the questions is about police and would you report something and do you have a sense of trust? And two of the individuals that were separate from each other both shared very similar input. They shared that they knew Kevin and Sean very well, and they said they're really wonderful, amazing individuals who really care, who really are building relationships, and they feel very bad for them because they are being swept regularly, and they feel like they have nowhere to go. Even when people connect to services more than they already are, even when they call shelters, we're usually full. There's still nowhere for people to go. People could be connected to everything and still have nowhere to live. So we just keep pushing people over and over and over. But they said, even with that reality, even with the hardship of having nowhere to go, they said, I feel sorry for them. They said, their jobs suck. And I know they don't feel that way, but they said, how hard must it be to build relationships, to connect with people, to really care, and have to keep telling people, you got to go. And they said, you know, we care about them and we think their jobs suck and it's got to be so hard for them and it's so hard for us. And two different individuals separate from each other both said pretty much those same things. So thank you. And I think they're being heard and seen as valuable and appreciated in spite of asking people, you got to go.
Thank you so much.
Thank you, Linnell. Are there any other questions for Lieutenant Didi? Seeing none. Thank you so much, Lieutenant Didi, for the report, and thank you for answering questions regarding the HST.
Yes, thank you.
Thank you. We'll move on to agenda item 4B, complaints of discrimination received by city staff.
So we received a formal grievance related to ADA violations regarding Section 8 housing inspection, which was then forwarded on to the Salem Housing Authority for request for reasonable accommodations. And that is all that was.
Thank you. Any questions for city staff regarding complaints of discrimination? Seeing none, I am pleased to introduce Jimmy Jones, the Director of the Mid-Willamette Valley Community Action Agency, who will be sharing with us how national and state level policies do affect local residents experiencing homelessness. So thank you so much for joining us this evening, Jimmy.
Good evening, Chair, Vice Chair, Commissioners, and members of the committee. For the record, my name is Jimmy Jones. I'm the Executive Director of the Mid-Willamette Valley Community Action Agency here in Salem. I also have a variety of other roles around the state. I'm the Vice President of the Community Action Partnership of Oregon, and in that role, I organize all of the legislative work for all of those agencies across all 36 counties, and I've been doing that for the last 7+ years. We are also involved in a lot of local, statewide, and federal advocacy, and that is in many ways a subject of why I'm here to have conversation this evening. But I'm grateful for the role of this commission. I'm grateful for the city of Salem for allowing space and opportunity to have these conversations in our city. It's not always the case across Oregon and around the United States that these important issues are addressed. This subject that I've been asked to talk a little bit about tonight is so broad and so deep, it is sometimes difficult to find a proper place to start. So what I'll do is I'll talk a little bit about what's happening at the state level that relates to some budget issues that are facing low-income people in this state. and in some ways, the services and resources and opportunities available for the unhoused population of our community and beyond. In doing so and beginning in that way, I'm also mindful of a lot of things that I won't have time to talk about. We are on the verge, on the precipice of a food crisis in Oregon, the likes of which we have not seen in 30 years. In the 1990s, Oregon was voted as the hungriest state in America. What a title to have. And we've made a lot of progress the last 30 years to change that narrative and to correct that grievous wrong. But at the same time, at the federal level, the administration has really reduced the amount of federal benefits that are available in terms of food banks, and has made last summer in July with HR 1 the decision to make it much more difficult to access SNAP benefits across the country. And that certainly will have a profound impact here in Oregon. The changes there are deep and broad as well in terms of eligibility and recertification requirements and work requirements. And literally we could go on for hours about that. So not only is food, but the Public Housing Authority program, which I won't speak much on here tonight. My colleague from the Salem Housing Authority is here and she can touch on some of those things if she would like. Medicaid, we could equally spend as much time on. We're looking at significant cuts there, which will impact the state budget, impact opportunities, impact healthcare and coverage across Oregon and around America. But I will spend a few moments on talking about homeless sheltering and homeless housing and the way and shape and form that's going to impact Salem in the very near future. So going into the last legislative session, before any of this federal conversation began, Oregon was facing some difficult choices. The revenue forecast was not quite as rosy and optimistic as it had been in the past. The governor put forth a requested budget on housing and homeless services of around $730 million. Because a lot of the budget realities, we didn't come close to getting that. We got around $430 million. And some of those areas inside that budget were significant reductions off of the 2023 to 2025 biennium. For example, the governor's recommended budget for eviction prevention. So our agency has ran probably the largest eviction prevention program in this community in the last 10 years. We have distributed probably close to $45 million in rental assistance over that course of time. But the budget statewide in 23 to 25 for eviction prevention was about $172 million. But what we got through the legislature in the last session was only $44 million. It was a 74% cut in rental assistance. So for context, my agency spent in the last quarter of the 24-25 year about $1 million in eviction prevention here in Marion and Polk counties. But the entire eviction prevention budget for the following year was going to be about $1 million. Now, we have found ways to bring extra resources to bear, but that kind of gives you an illustration of just how consequential a cut this was. So of that $44 million that the legislature appropriated for eviction prevention for the 25-27 biennium, only $33 million, or about 75% of that, is in what we refer to as continuing service level. And so that is the amount that's baked into the next budget. We'll have to go back and fight for that additional $10 million. The other three big funds in that broader housing and homeless services package were a few grants. One of them was called the Oregon Rehousing Initiative, or ORI as we call it. That was $50 million for exiting new people. It's a rapid rehousing program, exiting new people from the condition of homelessness into housing. But only $25 million of that is baked into CSL for the coming 27 legislative session that will determine the 27-29 biennium budget. There's another program called the Long-Term Rental Assistance Program, which I really am a big fan of. It works better in some communities than others. Statewide, there was $87 million allocated by the legislature to that particular program. Not a single dollar of that, not $1, is baked into continuing service level for 27-29. And that fund went to formerly homeless individuals who had been housed on that program to provide for continuing, out of the emergency order, to provide for continuing housing support for higher needs clients who really just aren't in a position where they're going to be able to be self-sufficient in the near future. And then the last of the four major programs, the biggest one, out of all of that is the statewide sheltering program. Now, sheltering was basically a charity model activity in Oregon prior to about 2020. And by that, I mean it was private organizations on private funds, and many of them had very high barriers. So, for example, some of it was religiously organized. So clients felt like they had to participate in religious services, church services. And, the old saying was, we had to pray a certain way in order to be able to get a bed. So that was the status quo prior to about 2020. In much of Oregon, it was private model, it was charity model, and it was heavily high barrier, came with restrictions and religious expectations and things of that nature. Through the course of the pandemic and then with the emergency order in 2023, the state changed to make this largely a state-supported activity with state requirements around low barrier activities, non-religious requirements, not enforcing sobriety requirements and things of that nature. Problem with sheltering is it's very expensive because you have to have staff 24/7, 365 to make it work. So that budget for 25-27 was $207 million, by far the largest percentage of that entire program package. Only half of that $207 million is baked into continuing service level. So as early as July 1 of next year, the resources for 50% of those resources rather could go away. So you could be looking consequentially statewide at a 50% reduction in the state sheltering capacity about a little bit more than a year from now. So I don't say all those things to scare people, but I put them into to this context to make sure that folks understand that the entire state, this community in particular, which has, by the way, about 25% of those statewide sheltering dollars. We've done such a great job here in this community of bringing those resources here. Typically, Marion and Polk counties get about 10% of any statewide allocation, about 10% of any statewide formula. We got a 25% of this because we did such a good job with it. We're outperforming the rest of the state. That's why those resources came here. But imagine, if you will, a doubling of the Salem street homeless population over the course of next summer, a doubling of what you see downtown, a doubling of what you see in Wallace Marine, and a doubling of what you see across the community. It would be devastating to Marion and Polk if we're not able to resecure those funds. And we're certainly going to fight for them, and I have high confidence that we will get them, but it is not a guarantee. So the budget environment is really constraining all of the potential future housing and homeless activities, sheltering in particular, that could be going forward after next summer. And there are a lot of competing needs. And the last thing that any of us who do this for a living, so to speak, are trying to do is to pit one group of poor people against another. In fact, we fight to make sure that doesn't happen. But, how do you solve these problems when Medicaid is being cut, when SNAP is being cut, when housing assistance is being cut, when there are fewer, potentially public housing authority places, and they are more restrictive than they have been in the past? So there are choices that will have to be made and priorities that will have to be selected, none of which are very obvious to us sitting here at the moment. And then, compounding the state issue, we have the federal situation. And again, I could talk for a long time about about food. I could talk about Medicaid. I could talk about, the immigration challenges and other issues that we have, the refugee issue. But in the time that I have, I was sort of asked to talk about, what are the current housing realities. So at the federal level, most of the money that comes into our community is channeled through something called the Continuum of Care, a COC. Those have been around since the mid-1990s. They have a long history in terms of why they were created. But basically, the idea was to put federal money into local communities in the hands of its leadership and let them decide what the highest priorities were in alignment with the federal government's priorities at the same time. So that federal system is really sort of designed and encapsulated around several core best practice principles, several ideas about how the work should be done, how it's done well, and proven again and again and again by research-based, data-driven solutions. And that COC system was designed around the idea of we don't want to warehouse the homeless, we want to get them into housing. We want to adopt housing first principles of not creating pre-requirements that people cannot meet in terms of high barrier policies, right? We don't want to require that somebody be sober. We don't want to require that they accept a certain kind of service. We don't want to require that they submit to mental health evaluations and mental health services. We don't want to require that they participate in a religious, program. We don't want to require much, if anything, at the beginning. We're certainly going to work with people after they're housed to get them the help that they need. So that COC system was designed around these principles of housing first, designed around the principles of client choice, designed around principles of what we refer to today as harm reduction. Now, that phrase has gotten a really bad name in recent years, a very political name. But all harm reduction really means, its most simple and basic explanation, is we realize that a client, a person, which is a better language for what we're talking about here, a person might be doing harm to themselves today. They might be doing drugs today. They might be engaged in unsafer, behaviors we really don't want them doing. But instead of denying them access to service because that they're doing harm to themselves, we're just going to work with them so that they may be doing harm to themselves today. We want them to do less harm to themselves tomorrow, and maybe eventually over time to do no harm to themselves at all. It is a realistic approach that realizes that people may not be able to comply with programmatic expectations at the onset, and the expectation that we're going to pick up the lion's share of that and work with them to better outcomes. So that was the core and crux of the COC program. In the last 10 years, this concept of housing first, and especially harm reduction, but even housing first, has become politicized and it's become under enormous pressure. And there are groups around the country who truly and really believe that this is the wrong approach, that it is doing harm to clients, that we should expect more of them, we should impose more requirements, and that they will somehow magically, in my lens, figure it all out and pull themselves up by their own bootstraps and solve their own problems. There's no evidence anywhere to suggest that this works. In fact, we have 30 years of evidence prior to around 1995 that it will only fail. But it has become the kind of watchword for a number of organizations around the country. And these private think tanks have really, really informed the approach that the federal government is now taking. So I don't ever believe in sort of talking about innocuous entities out there without naming names, so I'll just name them. So the Discovery Institute in Seattle, which was founded as a Christian Science organization and is really a faith-based entity and is promoting, that solution to, housing instability, has taken a major role in that approach. The Cicero Institute, which runs model anti-homeless bills across the country, encourages local governments to criminalize poverty, criminalize homelessness, and to punish poor people, has also played a major role in this. You see recent laws in Louisiana, in Mississippi, especially Georgia, around recriminalizing poverty, criminalizing homelessness. Cicero and also the Manhattan Institute have played major roles in shaping and defining this new HUD philosophy and process. So last year, to kind of tie this up, HUD attempted to issue a new, what we refer to as a NOFO. So that's a Notice of Funding Opportunity. Just housing is full of acronyms. That's one of the ones we use. So new NOFO. And that NOFO would redesign the federal system, taking money away from permanent housing and using it on these other philosophies. So the administration's proposed approach was simply to take the housing dollars, which made up more than 90% of this federal resource coming into every community, to take the housing dollars and carve them up into 3 buckets. The first bucket would have gone for treatment. It would have gone to outreach. It would have gone to those kinds of supportive services, which, don't really house anybody. Helpful, encourages people to get there, but it doesn't actually pay for housing for anyone. The second bucket would have gone toward transitional housing. Now, transitional housing, and I don't want to drag it at all, my agency operates a kind of transitional housing, transitional shelter. It's not fundamentally a bad idea. The problem with transitional was that in its history, especially, when it was funded heavily, is that approach was primarily associated with high barrier policies like required religious services, like sobriety, on and on and on. And it's no longer scalable to the size of the problem that we have. There's truthfully somewhere between 25 and 30,000 people living outside in Oregon. That's probably, 80%, 90% of what there really is. You could get much higher before we're all done. So the second bucket was transitional housing. There's no research out there to suggest that that's going to be a scalable solution to the problem that we're facing, despite what a lot of people will say. And then only 1/3 of those resources were going to go to public permanent housing. So out of all the people that are supported by current housing assistance for formerly homeless individuals, 2 out of every 3 were going to be kicked out of their homes or put into one of these other models. 2 out of every 3. So the court stopped that. My agency has fought it. The organizations that I work with and are affiliated have fought it. But the handwriting is on the wall. And the administration in June plans to put out a new NOFO embedded with these principles. So I have spent the last week organizing a letter from all shapes and stripes, political persuasions across Oregon, agencies, local governments, to ask HUD to allow local control and local flexibility to remain so that we can treat our problems here in Oregon the way that we know best. I'll kind of tie it up there and sort of let you ask any questions that you want. There are a whole host of other issues. So for example, and Nicole will be up here in a few minutes, but for example, one of the things that the administration has proposed for public housing authorities is that an old rule which would essentially allow Section 8 vouchers, public housing authorities and things of that nature to house undocumented residents in their homes. Traditionally, in the past, HUD would say, for example, if one resident in the home is an eligible citizen, then the household could receive proportional assistance. That's been the rule for 2 decades or more. The administration has proposed a rule now, if one person in a house is undocumented, the entire household is ineligible. So that's out for public comment. I think the public comment just closed. There are other possibilities out there around work requirements, a whole host of other things that would sort of turn back the tide and turn back the clock to an era in which we treated poor people in the country very, very, very terribly. And I feel whether we're talking about the homeless issue, the public housing authority issue, or many other issues, we are reaching a time that, it's going to be much more difficult to provide safety and dignity and justice to low-income people across the United States. Happy to take any questions.
Thank you, Mr. Jones. Are there any questions? Commissioner Marys.
Hi, thank you. So we heard from, I'm sorry, Lieutenant Dede, Sergeant Dede, that, we're making more connections and more people are being referred to resources. And then we heard from Linnell Wilcox of First Sleep United, something like that. I'm sorry, Linnell, that there are not enough of those resources for all of the people that are being referred. Now we are hearing about how there is going to be so much less funding and conditions attached to services in the future that is going to basically, tie our hands in some places where we're actually seeing improvement. One of the students from Professor Bradshaw's class, who is conducting the community belonging survey, when we met with them, said that another municipality, I don't remember where it was, had chosen to have the leadership declare the homelessness issue a public health issue in order to release more funding to support, homelessness services. Is that something that we could do? And Mr. Jones, is that something that you sit in an arena to take forward?
Chair Marshall, Vice Chair Ballard, Commissioner, that's a great question. Some of that is sort of already happening in a number of regards. So Oregon has a Medicaid waiver from the federal government. It's the ability to sort of provide financial assistance to households under this larger framework of the social determinants of health. So You heard me reference a little bit earlier that eviction prevention budget cut crisis. So one of the things we've been able to do is, despite the fact we're dealing with 75% less resources in that area, we run a program called Health-Related Social Needs. We're able to bill Medicaid. And as a result of that, we've more than doubled the amount of state resource that we have to be able to put back into the community to keep people in their homes. Program is not perfect. They have to be on essentially the Oregon Health Plan, Medicaid. You know, it isn't a one-time program for a lifetime in a lot of ways. So, you know, there's some real limitations around it, but it has been successful in that regard. With regard to the issue in Wallace, these things are really complicated, and I've been on record. I've written op-eds that saying sometimes trespassing homeless camps are necessary, especially when there's a public safety reason and there's a public health reason, which are, you know, are not uncommon as well. I've worked with the Salem Police Department for a decade now. It is one of the most professional organizations I've seen in the entire state of Oregon. I'm very grateful for the way that they approach the homeless issue here in Salem with kindness and with dignity and with empathy and with the desire to help first. They certainly have a job to do, and none of us want the number of people in Wallace being what it is. But in my experience, they have done a fantastic job in making sure that they handle this in the most modern and just and humane way that they can while still, you know, upholding the law. But I think Commissioner, I think the nature of your question is dead on. You know, we can't just rely on the traditional general fund resources from the legislature for housing and homelessness. We need to leverage other organizational, other state departments, other resource funding streams to be able to help solve this. And so the Oregon Health Authority, the Oregon Health Plan, the HRSN program, all of those things are good ideas that we need to take more advantage of going forward.
Thank you, Mr. Jones. Vice Chair Ballard?
Thank you, and thank you for coming tonight. I actually have a few questions. First, you mentioned that Marion Polk counties typically get about 10% of the state resources for homelessness, potentially even more.
Chair, Vice Chair, thank you for the question. Typically, so there's several things going on here. First, I would say that our region has particularly been at the end of the line in Oregon for getting resources that should be coming back into this community. There's an old joke in the legislature that, you know, Portland gets everything, and there's always been a little bit of truth to that. But then the next question that comes from that, who's second in line? And historically, a lot of times, who's been second in line is rural Oregon sometimes. Sometimes it's been the city of Eugene and Lane County, and Marion, because the state capital here and a variety of other reasons, has tended to kind of follow up toward the end of that, you know, funding priorities. So we saw that in affordable housing in particular. We're still, you know, probably $1 billion, maybe 1,000, you know, closer to 2,000 units behind what we need in the city of Salem. Sheltering is a little bit different because all of the sheltering providers in town, at least the publicly funded ones, so Church at the Park, our agency, United Way with Safe Sleep, Center for Hope and Safety, and all the others did a really good job of opening new shelter beds during the course of the pandemic and especially around the time of the emergency order. So the state's priority was to preserve those existing beds. So as a result of us being ahead of the curve, we kind of got ahead of the line in terms of bringing more than twice the amount of normal resource we get here. So that 10% number is really proportionality in terms, we have about 10% of the total population, so the funding tends to be about 10% of the statewide total for most things.
Okay. You did say that we handle sheltering better than other areas?
I would say that without a doubt. I would, and what how I would answer that is by, you know, pointing, without naming names in this case, you know, you can see other shelter providers around the state that still have some sort of work requirements, for example. They're required to do X number of hours of chores to be able to stay in shelter. So it's essentially turning your client population into your workforce. So there's a lot of bad habits and that sort of thing. There were, the city of Salem was very aggressive, and I'm talking about the Salem City Council and the Salem City government was very aggressive about making it easy for shelter providers to get siting and permitting so that, and then the fire department worked with us very well to make sure that these places were safe and compliant. So all of those forces working together managed to open more shelter beds here proportionally than anywhere else in the state. So it is a little bit of a historical accident, but it's also the product of a lot of people working very hard.
Thank you. That kind of leads a little bit into my next question. the fact that we do handle sheltering better than other areas of the state, i- it, I've been noticing, so that makes me really proud, but it also shines a light on the next issue. You mentioned phrases like harm reduction and housing first are developing a bad rap. And I've seen, I'm one of those people that are referred to as terminally online. I spend a lot of time online reading forums. I want to know what people are thinking. And I may not participate in all those conversations, but I definitely read a lot there, and I read a lot of academic papers as well. So the language that's being used, and I'm seeing this being used more and more in our community, things that demonize the homeless population. Words I've seen recently to refer to the homeless include zombie and lizard. And there's a constant barrage of negativity and a false narrative about what safety and livability should be here in Salem. And we need to remember that that includes the homeless population. They need to be safe and they need livability as well. What can we do to start reducing that negative language? What can we do to create more? Because when we change the language we use, we change how we think about things. So what, do you have suggestions for us about that?
Chair, Vice Chair, members of the commission. So all of those thoughts and observations are on my mind and heart on a daily basis. I've observed, Commissioner, the very same things that you've observed as well. I have been on record in the media repeatedly, and not necessarily the most popular thing sometimes, but cautioning our elected leaders, our elected officials, our community leaders, our leaders of our, our city managers and a whole host of other folks about the language that they use around this particular issue, because it is incredibly dehumanizing. It deprives people of human dignity if it's framed in that sort of way, and it is fundamentally dangerous. We have seen across the country and in this community homeless individuals targeted just because they didn't have a place to live. We've seen people die as a result of that across the country and here in Salem as a result of just random targeted act of violence against unhoused people. And I think that tone has to begin at the top, and then it begins to filter down. Part of what's going on, especially in the online environment and Facebook and other places, is that, it is the product of a targeted influence campaign that takes advantage of the algorithms and other stuff to generate fear, anger, rage. And, if you just watch, as you have watched, the kinds of words that are used to describe the homeless population, it is designed to produce fear, anger, and outrage as if they are doing some harm to the rest of us greater than the harm that's being done to them. Around 5 or 6 years ago, there was, when this stuff that you're describing was first emerging at the scale it's at now, there was a famous video out of Seattle called "Seattle is Dying." Some of you may have seen that video back in the day. And it was just sort of ambush journalism on the street, interviewing homeless folks in sometimes in states of mental health crises or drug addiction and things of that nature. The words were twisted and manipulated to present this picture as if these individuals were somehow, a blight on society as a whole, that they had nothing to contribute, that they were only a drain, that they were somehow killing Seattle. Seattle is dying. Seattle was dying because of an act of violence taken against Seattle by these poor folks. The problem with that narrative is that it is incontrovertibly false, right? I mean, it's very easy to see that it wasn't true. Seattle is one of the most economically vibrant and thriving cities in the United States. It's incredibly wealthy by national standards. It is doing exceptionally well on every front. Yes, it has a major poverty problem. Yes, it has a major homeless problem. But, blaming people for, let me just say it this way. It is incredibly uncomfortable for folks to witness the suffering and poverty of other people. And so when folks drive past our day center on 615 Commercial, a lot of times their guttural response to that is, I don't want to see it. I don't want to see people suffering. I don't want to see people hurt. And that is the right reaction, to be frank. But then if the answers, whether it's coming from online or local officials or whatever, if the answers then lead people into, it's a question, who is really to blame for all of this? And the answer to that question continues to circle back toward, it's that person outside. They're the one to blame. They're the one I'm going to hold accountable. They're the one I'm going to shame. They're the one I'm going to punish. They're the one I'm going to demonize and dehumanize and deny dignity to. That's not the answer that we want. And yet, that is the culture that we're living in at the moment. So we have to start at the top. It's all of our responsibility to do better and to make it very clear to the community as a whole that the lives of these folks outside are just as important as anybody else.
Thank you.
Thank you.
Just one more quick one.
We're going to go to Commissioner O'Shea.
Oh.
Commissioner O'Shea?
Okay, sorry. I hear a lot about what you're sharing as far as the federal and state dollars. My question, I guess, just from your perspective, when it comes to what the city specifically is responsible for, like my understanding is that like I don't know, social issues might be the wrong word, but that kind of thing is more like county related. Can you maybe talk with us about maybe, I don't even know what I'm trying to ask. Is it, how much of the city's responsibility is it? Like, do we need to fund these? Does that funding come from the county? Does that funding, is it really just state and federal? And is that traditionally the responsibility of the city, and how have we morphed? And in all of that, I want to know from you, what do you really want to see from like our city council and our leadership to make all of this go faster, and what do you see as the biggest need from that leadership? You can answer that however it comes out.
Chair, Vice Chair, Commissioner, thank you for that question. It's a challenging one I get fairly frequently, and one I'm going to be pretty blunt about. So I'll just get into it. The fundamental reality here is that in terms of public health dollars, which is the largest potential resource for leveraging the other state and federal homeless dollars that are coming into the communities, those are the province of the county, the counties in this case, and to the extent that there could be more local support, it would primarily have to come from Marion County and Polk County. Now, they're doing a lot, and I don't want to dismiss that. I don't want anybody hearing this conversation for me to think that I'm sitting here suggesting they're not doing enough, or they're not doing well, or they have the wrong priorities. That's not what I'm saying. But if they decided to prioritize and align the health department and align the housing authorities and align their other services to prioritize and combat this problem, that would be helpful. They are certainly doing that in some regards. I think there are further steps that they could be taking. At the city level, you're correct. The cities are not primarily resourced or directed to, in terms of obligations under state law to be addressing this problem at all. Now, having said that, some cities around the state have prioritized this issue. You see it in Eugene, which is a comparable city. They have a little slightly different tax base than we do here. You certainly see it in the metro. It would take, if you want the most direct answer to your question, it would take extraordinary political will on the part of the city leadership, the city council, to begin to sort of develop new revenue sources to put into this problem. So I think that's the crux of the question. And there hasn't been a whole lot of political will to do just that. And if they're not going to do that, I think the second dimension of that question is essentially, I think, the relationship with the nonprofit community in the city has not been as strong in the last few years. And I don't attach that to any political figure. I don't attach that to any administration. It's just a simple fact of reality. It has not been as strong with the nonprofit community as it was 5 years ago, 7 years ago. So I would certainly encourage them to reach out, to understand those resources a little bit better, to advocate for the role of the nonprofits in the life of Salem, so that we are able to better leverage and better accomplish our collective missions. And I think all of the nonprofit organizations in the town would appreciate broader and deeper engagement on that front.
Commissioner Laura Midkiff.
Yeah, thank you. Thank you, Jimmy, for coming. It's good to see you. I've heard you give versions of this talk over the years, and I think what that underscores for me is kind of the endemic nature of so many of these challenges, though they are, of course, particularly acute. I think I have maybe two big questions. One is, I think it'd be helpful for us to hear from you a bit more about the precarity that people are facing. I'm thinking now particularly of working people and low-income folks in our area. We have over 500,000 Oregonians who are food insecure. Some rural counties in Oregon who, 1 in 5 kids are food insecure, and those trends are comparable here in the Mid-Valley. And we have obviously a lot of folks who are experiencing unsheltered homelessness. And the severity of that situation, the acuteness of it, threatens to worsen with the lack of funding. But then there's also the dimension of just living is getting harder. And it's getting more expensive. And so there's also all the structural threats of the things that create houselessness, cost of living, inflation for folks who are on fixed incomes, being able to afford your housing when you do have housing, just living paycheck to paycheck. So could you, for the first question, would you be able to spell out for us maybe a little bit more mechanically some of those other dangers? So in other words, there are people who are facing increased precarity because of this funding crisis, but then there are people who are entering this crisis maybe for the first time, or maybe re-entering it due to the precarity of our economic situation, and how are those two in conversation with one another for you?
Thank you, Chair, Vice Chair, Commissioner. This is the most precarious moment for low-income people in the last 30 years in terms of what we are facing in the near future. If you just think about the cost of living today versus 10 years ago versus 20 years ago, think about the cost of rent today. The rental increases in Oregon were allowable up to 9.5% in January. We'll face a similar increase next year based on the methodology that's being used. Folks who were paying $800 in 2014 were paying $1,800 by 2022, are now paying $200 here in 2026. There's a breaking point at which the sustainability of a lot of our working class families we're rapidly reaching the precipice on that. The social safety net, especially the one we've constructed deep in time in the 60s, 70s, and 80s, that was, frayed certainly in those generations by the end. And then the new one that we've built does not have the capacity to meet all of the need that's coming down the road. So whether you're talking about food insecurity, whether you're talking about, the need for public housing authority placements in the community, whether you're talking about the need for homeless services or eviction prevention or energy assistance or, maintaining your low income, the viability of low-income families and through weatherization programs and energy assistance and things of that nature, it is all fraying at the edges and about to burst because the cost of the livability, the cost of sustaining a family is becoming untenable in Oregon. So just imagine for a second, you live 10 miles outside the city, have a $20 an hour job in the city, you're supporting 2 children, you don't have a housing subsidy, and you get up in the morning and gas is $5.20 a gallon. So you're making choices whether or not to put gas in your tank or to buy food that night if you don't qualify for SNAP benefits anymore. You're making the choice between whether to put gas in the tank to go to work and pay for childcare, which is exploding in terms of cost. You're making a choice between putting gas in the tank and buying medicine for your mom. So this is all rolling downhill faster than we can keep up with it. And there are national and international reasons for why a lot of this is happening well beyond the control of local decisions made in our community. At the end of the day, primarily what we have influence over are, the actions and choices of our local government, to some extent the state government, very little with the federal government, and certainly not with the broader social and economic forces that are at work to create this lack of affordability crisis that we're living in right now. But to the core of your point, Commissioner, there are people that are entering this arc that 20 years ago wouldn't even imagine that they would be struggling to pay their bills on this scope and scale. There are folks who are showing up at food banks for the first time looking for food. There are folks who are calling around to see what eviction prevention is available, and then, realizing that there might be a 3 to 6 month long wait list. There are folks who are, who just had a baby and thought that they would be able to find affordable childcare in our community, only to realize that it's not there. There are folks who were hoping to buy a home at some point in time in their life, only to realize that they will, in their current, sort of situation, never be able to assemble the resources that are needed to be able to make a down payment or to be able to afford a mortgage with the interest rates being currently what they are. And we don't want to build an Oregon where our children and grandchildren have to move to Idaho to be able to afford to live. And that is where we are headed if we don't begin to do better. So at the state level, there are choices out there, especially choices related to revenues, choices related to land use, choices related to tax policy. All of those things out there could be re-examined. We've just been, our political will to do so has not been there because we have not prioritized the needs of low-income individuals in particular. I fundamentally believe, and I'll kind of finish your question with this, I fundamentally believe that any society is judged by the way it treats those in greatest need, those who are most vulnerable, those, who are, suffering. And if we can't treat each other well, and especially we can't treat folks at the bottom of the socioeconomic scale with the same sort of justice and dignity that we treat the rest of them, then that says something about us as a culture, says something about our character, says something about the reason that we're here. So I hope that part of this transformation that's needed isn't just about budget, isn't just about priorities, it's about who we all are as a people and a culture.
Thank you. My second question has to do with maybe the negative of Jackie's question about what the city should do, and it's what the city maybe shouldn't do to exasperate this crisis. I remember during my brief tenure on the planning commission, for example, I was trying to have a conversation around tenant and renters' rights.
Yeah.
And I was laughed out of the room, out of the chambers, basically. And it feels to me that almost at every turn, we're told, we being even people who are ostensibly in positions to think about these things, you can't do that. That's a state thing, or that's a county thing, or that's we at this pocket of the city doesn't do that. And so it just feels that our options are always winnowed for us, when I think we should be thinking consistently. We should be centering one, of course, the circumstances that folks are facing, but also we always should be thinking expansively about what our options are. So I'm not asking you to give all those options, and I don't want to repeat Jackie's question, but are there things in your mind that are potential outcomes from a city perspective, because we are constitutive of the city, in the immediate future, that we really shouldn't do, things that we really must avoid at all costs?
Chair, Vice Chair, Commissioner, thank you for the question. I think the answer to that question lies in this room more than anything else. The sort of typical response, well, that's not our responsibility, that's not our job, that's not our province, that's somebody else's decision, is actually an invocation to action. And what I mean by that is that when you don't have resources, you don't have authority, you still have a voice about right and wrong and what can be done and what should be done. So a lot of times, Human Rights Commission across the country, and this one is actually an older one, right? It goes back way deep in Salem's history. It has a unique opportunity to shape and frame the argument, to tell the city council and the city government that these things are important to us. You know, you asked us here to do this job, and we are speaking on behalf of all people of this city, that it's not just people who are, you know, living in $500,000 homes, making six-figure salaries and driving $50,000 cars that are important, but it's the rest of us as well. And so long as you are, you know, in charging us as a commission to be able to go out and speak for people who can't have the opportunity and the resources to speak for themselves in that way, we're here to say that these things are important, and we think you should think that they're important as well. And even if we don't have the power to change anything, we at least have the power to say something. And so my advice then on that front is that this body should become a little bit more aggressive about making sure that, you know, the voices of the voiceless, and that way of saying it, actually have a means to speak truth to power. And so my advice is simply to ignore that negativism, to ignore that sort of, you know, well, stay in your lane kind of comment, and to say, you know, it is a world that we want to build that is based in justice and dignity, and not necessarily in what's plausible at this moment.
Thank you, Mr. Jones. Commissioner Coleman, do you have any questions? I have a few questions of my own. We received comment several months ago from an individual talking about energy assistance, talking about how the city of Salem advertises community action agency as being a provider of energy assistance for the city of Salem, but then asked, how does somebody experiencing poverty who's working a full-time job but then also needs energy assistance, how do they access energy assistance if they don't get off work till 6 o'clock and poverty doesn't have banker hours? So my question is, what is Community Action Agency doing to ensure that anti-poverty services are available to individuals outside of a traditional 9 to 5 Monday through Friday?
Sure, thank you for that question. And I absolutely, totally agree with whoever made that comment, whenever they made it in the past. That has to change. You know, the state's energy programs, you know, that we run, designed by the state for the most part, were designed with this mindset of, you know, there's never going to be enough resource to go around. And so, and frankly, there isn't. Right now, we have about 19% of what was truly needed in the community. So it should be, you know, designed in the most rigid way fashionable, so that we can, quote unquote, the old famous phrase in the services across the state, were to thin the line. But that's no longer acceptable here in 2026. We are looking at, you know, new systems which will allow us to have 24/7, 365 access for people to apply. I think you'll see that within the next 6 months to a year, maybe sooner. You know, some of this is a conversation between state funders and local organizations and things of that nature around state manuals and all that complicated technical stuff. But the truth of the matter is, these are state benefits, right? They don't belong to the agency. They don't belong to the people that work there. They're state benefits, and they need to be available to the public. At least it need to be, there needs to be access to for the public whenever the public is able to engage with the resource, and that's the world we're trying to move toward.
Thank you. Our next question. What happens to people experiencing homelessness who are unable to remain in shelters because of serious mental illness, cognitive decline, substance use disorder, or an inability to manage basic activities of daily living like hygiene, medication, or personal care? Where are they realistically supposed to go when they don't fit traditional shelter models, but also don't qualify or have a means to pay for higher levels of care?
So I just told y'all a long story. Thank you for that question, Chair. I just told y'all a long story about how this region is doing shelter better than everybody else, and how we have more capacity here than virtually any other part of the state, and how other communities are really angry that we have so much here and are trying to tear it away from us. And yet at the same time, despite all that, there are still problems. And some of those problems relate to the nature and design of the sheltering services as well. So in Salem, the kind of shelter that we have, and I'm going to just use a little bit of technical jargon, I won't get too deep. What I would characterize the shelters that are available here are transitional shelters. They are programmed shelters. And by that, I mean the state pays the bills. Their funding priorities are housing-focused outcomes, right? They want you to put a person in shelter, they want you to get them out of shelter, and they want you to put them into a home. So it's housing-focused outcomes, transitional shelter, or programmed shelter. So that's what 90% of the shelter beds in this town that are state funded are. there's actually a gap for a very unique type of shelter that we don't have here. So on the East Coast, if you go to Philly, you go to Boston, you go to New York City, you go to any big city on the, east of the Mississippi River with any sizable homeless population, even in Atlanta, they have true low barrier emergency drop-in shelter. That is, and what that looks like, if you've ever been to Philadelphia, for example, is you get in line at 5 o'clock in the afternoon, 6 o'clock in the afternoon, depending on the time of year. And first come, first serve. LA has a lot of these too. First come, first serve. And those are more commonly structured like warming centers. So if you've ever worked a warming center, you've ever been in a warming center, you know that a lot of the behavioral health issues that we see manifested there that wouldn't really sustain for a long period of time in a programmed or transitional shelter are something we can work with fairly effectively there. So I do want to, and this, of course, I'd have to get the city's permission. It's a long process. I got to find a way to pay for it. But down the road, I would like to open a true low barrier sort of drop-in shelter that's not programmed. That's a problem with state funding right now. That's not programmed, but that would allow folks in the downtown or on Lancaster, which I think is where, we're not doing a good job. Any of the shelter providers are doing a good job, and certainly the city and the community as a whole. Those areas where we could have drop-in shelters that would help get people off the streets. Now, there are other conversations here too, and I struggle with the whole state hospital issue. I'm very well versed in the history of that. I know those things reached their peak in about 1955 when there were 475 people per 100,000 in one of these sorts of mental health hospitals. There was abuse, there was a neglect, there was malnutrition, there were all kinds of horrible things that happened. And the decision to deinstitutionalize them felt just at the time. But there was a percentage of the population that just needed a higher level of care than the current sheltering model in our community can solve. So out of the entire Salem homeless population, what percent would I say, if we had a bed for every person, what percent would I say could be successful in the sheltering models that we have now? About 85 to 90%. But that's still 10%. That's a lot, right? It's the folks that we see outside of businesses in the downtown. It's folks that the police department interacts with every day. It's the folks who struggle to know what day of the week it is or where they are and those sorts of things. There is still a need for a higher acuity of care in those circumstances and situations. The problem on that front is that ship financially has sailed. The idea that we're going back to a 1955, 1960 style federally supported state hospital system in the United States is folly. Texas just spent several $1 billion, the exact number, $2 billion opening an additional 500 permanent beds. I mean, think about that in terms of what that would do to a state like Oregon. And it still wouldn't, what are 500 additional beds? And it's probably not going to make that much of a dent. So we do have a need for higher acuities of care. There are barriers to getting folks into those higher acuities of care. I chaired the state's joint task force, legislature's joint task force on hospital discharge. The hospitals are struggling to find places for people to go. And what I discovered in chairing that task force was, frankly, the post-acute care side. So skilled nursing facilities, long-term adult foster care, all that stuff is wildly underfunded, under-resourced, understaffed, under-supported. So there are whole systems in the state that need to be built back up to adjust for some of that differential that the sheltering model here in town can't support.
Well, thank you, Director Jones. We do have quite a bit of other business on the agenda. I do appreciate you coming today to present to the Human Rights Commission, and we look forward to potentially having you back.
Thank you, Chair. It was a delight to be here.
Thank you. We are going to just make a quick switch in the agenda just because Commissioner Lara Midkiff does have to jump off at 7:30. So we are going to move to the Disability Rights Task Force update. It's got a couple minutes on that, and then we will resume with Director Oots. Commissioner Lara Midkiff.
Yeah, thank you. Sorry I had to have to leave a little early. I was just asked to briefly bring back to this group a conversation that we'd let slip beyond our fingertips ever so briefly, which was the work of the Disability Rights Task Force, which of course has been sunset. Actually, a body which Mr. Jones was an early part of, and thank him for his early commitment to that work. And brought wonderful people like Tony to us. Anyways, and so there's all these recommendations which you are all by now familiar with from the end of the year when it was presented to us. But there was this hope among leadership to bring this back into the conversation of the commission, and more importantly, to get your input about how to prioritize these recommendations in terms of getting them into the hands of partners around the city, and start hearing back from folks as they being partners digest our recommendations and come back and present on their feasibility, and we start working towards actually implementing a lot of these recommendations. Actually, Nicole and Salem Housing Authority would be obviously a partner in that work, and then planning as well. And so there was, I think, a hope that Robert expressed that we would be maybe briefly going through in kind of broad strokes these recommendations for those who may not remember them, and then maybe spend some time getting feedback about how to prioritize them. Fair, Robert?
Yeah, thank you so much, Commissioner Laramicka. Are there any questions on that? Yeah, so to recap, I know that Director Utz is here speaking. He's going to speak about the Bloomberg Harvard update, but we do plan on having her back in July, as well as Eunice Kim, to really kind of focus on some of the housing pieces of the Disability Rights Task Force, to make sure that we're able to improve access to housing for people with disabilities that are unable to access housing currently due to their disabilities, or people that might eventually lose their housing as they continue to age. So we'll be looking forward to adding those to July. So with that, Director Utz from the Salem Housing Authority, and friend. And you're welcome to also grab the black chair if you'd like, or I said you're welcome to grab the other chair if you'd like, or okay. Perfect. Yep.
Good evening, Chair, Vice Chair, and Commissioners. Thank you for allowing me to come. I'm Nicole Utz. I'm a Director of Salem Housing Authority by day. By evening and other times, I am a part of the Bloomberg Harvard City Initiative 7 group of 7 and the greater group of 30. We actually have a couple of extras here. So I had the great pleasure of coming here and speaking to all of you previously about the Salem Housing Authority. And one of the Bloomberg Harvard initiatives is really getting out there and finding those unheard voices. And when we came back, I immediately said, I need to get with the Human Rights Commission. I really want to tap into that unheard voice. I've had a great opportunity to collaborate on many projects, including Sequoia Crossings, to have lived experience there, involved in the design and completion. So more than anything, I'm here today to just kind of explain to you the Bloomberg Harvard Initiative is really, it is a fully paid for program that our mayor applied for. And we have the great pleasure, and I should probably let you introduce yourself.
And let me add to that, because I feel like sometimes it gets confusing about how this was set up for us and this opportunity that was given to us. So my name is Roberto Garcia. I work for Salem Leadership Foundation, and part of the group of 7 that Nicole identified is the goal and the hope was to have nonprofits, the faith community, be a part of and have a voice in this Bloomberg Harvard citywide initiative. And so the pieces, as Nicole was beginning to express, is oftentimes we've heard, well, who's paying for this? Well, there's an arm of philanthropy from Bloomberg Harvard that our mayor applied for, was accepted. She went in for some of the leadership training and workshops that was an opportunity for her. But then the next phase of that was the ability to do this work that we're talking to you about today, which is the Bloomberg Harvard Citywide Initiative. And that was all the work that we've done, everything that we've been able to do and travel and be a part of things in Boston was all covered. All the costs were covered through that philanthropy arm of Bloomberg Harvard. I wanted to be clear on that.
Thank you. So a little bit about how this got started. In October of 2025, the city had brought together the bigger group of 30, which consists of many various different perspectives through the city of Salem, meaning business owners, nonprofits, service providers, residents with lived experience, community advocates, neighborhood leaders, and the police department, fire department, housing, public works, and community services. In that group of 30 from October through January, February, and then into March, when we actually traveled out to Cambridge, we were deep diving into work around the public safety in the downtown core. And we've gained many different perspectives about what the core problem that the Bloomberg Harvard Initiative was trying to solve for. And do you want to explain what our problem statement is? I know you probably have the.
Oh, well, and we were tasked to identify, create the problem statement to be able to therefore move forward with ways to solve it and solutions. And so I think is that the part you wanted me to? We talked about to identify the problem statement. We were, let me preface this by saying we were given a lot of models that we were basically, it's like a plug and play model that Bloomberg Harvard was given. And so some of the wording, some of the verbiage that we were adding to an existing model that Bloomberg Harvard gave us. And so when we've presented at times, sometimes we just have to clarify that this is a plug and play model. We were adding our problem statement with some of the wording that was given to us. So does that make sense? Yeah. And so we talked about the problem statement had evolved and developed and grown and changed. But at this point, the last time we presented at the city council, we talked about the highly visible, unpredictable behavioral health crises are occurring in Salem downtown. Concurrent increases in criminal activity are eroding public safety. Together, these trends are undermining perceptions of safety, cleanliness, and well-being within downtown, reducing foot traffic and economic vitality while making public spaces harder to navigate for everyone.
And with that, we had to deconstruct this problem with subcauses, various different elements, and find entry points into the problem. And include, so amongst our group of 30, we have subgroups, which I happen to lead a subgroup over housing and shelter. And so we have various parties on that, as well as your subgroup.
Yeah, which was community focused, the faith community and neighbors. And there was a group of 5 of us that are out of the group of 7 that I was able to oversee.
And out of the 30 individuals that were a part of the team of 30, they were able to pick their first choice of what subgroup they would like to be a part of and what their second choice may be. And we broke out from there. We still continue to meet with our subgroups. We are meeting again in June with our reconvening the group of 30. And we continue to work on entry points to the solution to this problem. One thing I want to highlight is that we use the word specifically perceptions of safety in the downtown core. That I can tell you has been taken in many different directions since we've been working through this. And I just want to emphasize that this may be a perception of safety, but it's still something that we need to address in the solve for the community vitality and bringing all this vitality back to the downtown core. But that includes that we need to hear many voices that are not even included in that 30 team of 30 or our subgroups. And I'm hoping that I can work with all of you here in the future to make sure that we're getting perspectives of individuals, of our most vulnerable individuals in Salem, and what the downtown safety may mean for them. Does that look like clear sidewalks, needing additional garbage cans, Is the cleanliness an issue? Is there a perception with safety? Is there inability to access mass transit to be able to come down and enjoy the vitality of the town? For our unsheltered population, they are our most vulnerable population. There is a perception of safety amongst the unhoused as well, that we are also working as an entry point into solutions. But when you're trying to gain momentum in this problem, part of that deconstructing the problem is finding an entry point that you can gain momentum. And so cleanliness in the downtown core was that entry point that we felt we could move forward quickly, bring awareness to, and kind of kick off this entire community gathering. And it's been pretty amazing. We've had a lot of volunteer efforts that have been picking up in the downtown core. We've had a lot more involvement in getting the word. I know that we are working with the HST team and the Salem Clean team. We're working with Solutions with Main Street downtown. There's a lot of different aspects because ultimately our downtown, we want it to be the pride of the community. We want people to come down here. We want everybody to come down here, enjoy it, and get the perspectives of what would make this more safe for all parties that come into Salem.
And some of the stuff that we're learning more and more is we constantly are asking the question is which voices are missing? And as we've already stated, is coming here, I think the desire is to be able to present this with that, asking that question, what voices are we missing? What kind of feedback can we get? And to be able to understand that no one in the group of 7 feels like they're the authorizers, they're the final say. We were just the ones that started this, getting the momentum going. And our desire is to have invitations out to ask these questions. What voice are we missing? Who are we wanting to invite and be a part of this? Because there's so many amazing people in our community that can bring some things, because we're finding things out that we weren't even prepared for. As for example, Craig Smith from the Union Gospel Mission had offered to us that there's people that are staying at the mission who could be available and have some community service hours, have some free time, could very much be a help to the picking up litter downtown, going through downtown and doing different projects through the downtown corridor. And that was nothing that we would have ever thought of, but to have that voice and have that a person who could bring that to the table, I think that gave us a lot of hope. There's ideas out there that we're never going to be able to think of it. And so we want to be able to hear others.
And what success might look like would be cleanliness and safety in downtown, less disruption to visitors, residents, and businesses, fewer calls for service, ability for police and fire to attend to higher priority calls for services, businesses feel supported, and that there are better outcomes and well-being for those living unsheltered. And that is really our goal. We're wanting increased foot traffic, positive feedback from visitors, residents, and businesses, and increased public support provides momentum for future projects. So one thing I want to say is that the city was recognized by Bloomberg Harvard for being one of the most unique, bringing a perspective of outside of our city leadership team to this Bloomberg Harvard initiative. So we have Debbie Wells from Marion County Behavioral Health. We have Tiffany Bolgen, who is she's with Ike Box and Isaacs downtown. She's a downtown business owner. We have Roberto, we have myself. I don't think they've ever had a housing person on, so I brought a very unique perspective when they started talking about that.
When Nicole introduced herself, because it was just, for some reason, it was just a fascinating concept. Why wouldn't they have somebody from housing, right? And so, but we did, and so that was just it was interesting. Yeah.
I think this collaboration track and for being a director of a housing authority has also taught me to reach further, seek more, build more community and bring more
Yes.
voices to the table. And so I look forward to continuing this. And one of our goals with this is that we can replicate what we're doing in the downtown area into other areas of the Salem community. And we, the city of Salem did an amazing job. They were able to get a fellow from Bloomberg Harvard's program that is coming to Salem. She's arriving June
13th.
13th or,
Yeah,
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 13th or 14th.
Yeah.
And we've met her. Amazing, bilingual, very motivated. And we'll start a similar group of 30 for Northeast Salem. So our goal is really to replicate this into more areas of our community.
I feel like I cut Nicole off, so I have to apologize. One of the points you were trying to make is that the recognition that we were given as what Salem did uniquely was there wasn't another group that had anybody but city officials and government employees. So the fact that we brought these people who aren't government officials, city employees to the table, that was the uniqueness about it, is because I think our mayor wanted those voices at the table. And when we went to present and unpack a lot of this, that was identified as what a concept. Why are all these voices here? And I think we're discovering, and Bloomberg is discovering, that all those voices matter. It really has made a huge difference. So you guys need to know that.
And I know we're short on time, so I will just open this up to any questions and answers about the Bloomberg Harvard City Initiative. And like I said, we are open to the missing voices and getting more feedback from you in the future.
Well, thank you so much, Director Roots and Mr. Garcia. I appreciate you guys coming, and I admire the work that you guys have done on the Bloomberg study. I appreciate that both of you wanted to reach out to the Human Rights Commission and include us in the conversation. I think asking the question about unheard voices comes at a really great time. We just closed field on our community belonging survey today. I'm presenting an update about it. I do have a question. When's the next June? You mentioned the group of 30s getting back together in June. When in June is that?
That was sent out.
June 9th, I believe. I can follow up with
okay.
that for sure.
Yeah,
I was gonna say if it was after the 10th, we'll begin the students report after the 10th. But I'd be happy to present to the group of 30 after June 10th, once we get the findings from Western Oregon University about the community belonging survey, to deliver a presentation to the group of 30 or the relevant subgroup about what we had heard
Be great.
in that. I also would like to make the offer, if the group of 30 wants to change it to a group of 31, I'd be happy to serve as liaison between the Human Rights Commission and the Bloomberg Harvard study, or work if there's another commissioner or anything that's interested in serving on that, because I think and you're right. I think there's a lot of work that the Human Rights Commission can do in this space. I think some voices that we can lend. So those would be my offers there, but I do want to open it up to any questions from commissioners that might have regarding the Bloomberg Harvard study. Commissioner Coleman.
I don't have a question. Just a statement for the unheard voices or missing voices that you guys brought up. I would say in Salem, is it just Salem that you want missing
No,
voices from?
actually, the downtown is the back door to a lot of communities. So we're interested in even branching into other areas.
Ooh, okay. I think some of the missing voices in Salem, or the area I'll go with, the younger demographics. I think a lot of times in Salem, we, at least at the city level, you hear from a demographic that skews older. A lot of people say like legacy families or retired people control everything. So I don't know if you have a lot of younger people in the group. So if you do, then just ignore that one.
No,
And
that's a
then,
great suggestion, because I'm gonna just cut you off. I don't know that we have that many young folks, and so I think that's a good insight. Thank you.
and then at least like a couple people, maybe from the refugee population that have lived here and seen the environment change and grow over time. I think that would provide some valuable input as well. And the different colleges, I think, would provide some unique perspectives. If you look at Chemeketa versus Western, Willamette, I think you'd get some different input at all the different campuses.
That's all great. Thank you.
Those are really great suggestions, and believe it or not, I believe that is many of the suggestions building for Northeast Salem as well right now.
Commissioner Marys, then we'll go to Vice Chair Ballard.
Thank you. So are we including the voices of people with visible and invisible disabilities, like mental disabilities, developmental disabilities? Are we including those voices at this table?
Yes, I mean, that's definitely, if you have a specific suggestion that we can reach out to for lived experience, we're happy to, as well as in the broader group of 30, there are many advocates that are in there for those voices as well.
Thank you.
Vice Chair Ballard.
Thank you. Thank you so much for coming. I did see your larger presentation at the city council. So this is amazing work that you've done. Thank you so much for being a part of it. Just to follow up real quick on something Commissioner Marys asked. There is actually an advocacy group through an organization that was mentioned earlier by Commissioner Roche, PCL. They have a group called SPARQ, SPARQ, which is folks who are living with intellectual and developmental disabilities, and they engage in advocacy to the point, I mean, they even go to the legislature.
Great.
So if you could maybe connect with them, they could lead you to some of those folks.
You might have just answered 2 questions for me, because I have been asked, do you know if SPARQ also has an outreach team that goes into the field?
I do not know.
Okay, I'll follow.
Yeah.
Thank you for
Okay.
that.
That's
Yeah,
great.
absolutely.
For us.
Yeah, and I can connect you with my contact at PCL because she does a lot of the outreach and such as well. So she works like right next to the top people, so she could figure out who you need pretty easily.
Thank you. I can tell you that our HST team has asked me about a intellectual and disability outreach. They want to meet the needs of the individual in the field. So perfect timing. I appreciate this. I have been working on this solution also.
Great, great. So I was really excited to see what came back was perceptions of safety.
Yes.
And the fact that you mentioned that you'll be expanding into the Northeast corridor soon makes me extraordinarily happy, because the most recent thing that I saw regarding perceptions of the city that I hadn't really seen much of before was folks talking about the Northeast corridor being ghetto. And my suggestion for anybody who believes that is to go look at images of actual ghettos. New York City, Detroit, Baltimore, where there were and sometimes still are actual ghettos. That is not the case that we have here.
And I appreciate you bringing that terminology. It is very similar that our housing authority doesn't use the word projects. We have apartment complexes that individuals reside in. It's also I have many beautiful apartment complexes in Northeast Salem. So hearing these unfortunate terms is disturbing. So but we all have to work together to change this perception and build that community safety. And that's really our goal through this collaborative effort, is to work together on solutions that meet all of our residents, meets our businesses and individuals that reside in these areas.
Great, great. Thank you so much.
Thank you.
Thank you. Is there any other commissioners that have any questions or remarks for Mr. Garcia or Director Oots? If not, we will believe Miss Wilcox from the audience has a question. Yes, it's the microphone is the only way that they can hear us online. So
I'm also very grateful for this project and all the work that has been done and the work that will continue to happen. I do have some concerns that I keep bringing up, and I know it's not going to be on you two specifically. But I feel like it's important to bring up the balance. I feel like even the problem statement carries implications that the problems are because of the homeless people living downtown. So I feel like even the problem statement is not neutral or encompassing the all that we want to project and care for. You know, just as a really simple way to do that, and I'll keep saying this in the bigger group because I know this can't be solved here, but if people are listening, I feel like we need to acknowledge that I think it's still out of balance. If we say we want less disruption in businesses, we need to have a statement that we need less disruption to unsheltered lives. If we say we need fewer calls for police to protect businesses, we need fewer calls and lack of calls for individuals who are homeless and are being attacked and don't call. If we say we need to have businesses feel supported, we need to have unsheltered individuals feel supported. So if we're looking for balance, our own problem statement, I would hope, could include both the dualities. If we're saying all, we have to reflect all. And then the other concern I have that I will be bringing up at the other meeting, and I brought it up once, it's like it seems like now we've got a really good amount of things happening that are making positive changes, even to individuals who are homeless. I'm hearing some good feedback and some bad, but I'm very impressed and happy that we're hearing a lot of good feedback about the pieces that have already been done. But if we're talking about going to Northeast, and I feel like we're saying we want input from all, and all are saying we need bathrooms, we need places to go to the bathroom. We just did the community belonging survey, and so many people said we need power. Keep moving us if you have to, but give us power. We need to be able to charge our phones. We need to be able to look for jobs, make calls, be able to report things, request help, answer needs for help, volunteer. They want to use their phones, and we have no place people can charge them. So if we're talking about moving to Northeast when we haven't even addressed the unsheltered side of what we need, I feel like it's a little premature, or are we doing both at once, which is fine. But we've addressed the business concerns really well, and we haven't addressed the other side of it. And just with the timing of the belonging survey, I learned a lot. And, you know, even before this committee shares the presentation, I'm happy to share just some initial impressions at one of the next meetings. But I really feel like if we're not having every problem statement be two-sided, we're not really doing the best of the allness that we say we want.
And thank you. That's really, you always bring great perspective. And I think that's why you're part of
That's why you're at
the
the
group. And we truly appreciate that. But part of Bloomberg has taught us too is that there can be multiple iterations of the problem statement, and when you deconstruct it and balancing that out through the feedback as well. The initial entry point into cleanliness was to kind of jumpstart the momentum and get this situation going. One of the problem statement areas and deconstruction entry points, we know that we need to address more and completely, we call it fragmented system that needs to be included the mental health and many factors into the sheltering and solutions to solve. So we are looking forward to entering into other entry points. And one thing I can say is that we may be background voices for Northeast Salem, but the Northeast Salem group will be a completely a new 30. So that we're really trying to simultaneously focus on two areas, but not losing sight. So, and I'm honestly, I'm not sure that we could go and do both without losing focus on one area or the other. So
Yeah.
there are many experts in town, and I truly believe that there will be another 30 wonderful voices that will help bring that collaboration together for Northeast Salem.
Yeah. And I agree. I just feel like if on our original, some of us are on the Bloomberg 30, but if the original problem statement isn't revised to reflect the duality, I get that you're doing a big project in an intense way, but if it's a work in progress and it's, going to evolve, can it evolve with the balance that we want? And can we also include the conversations about the things that the individuals, we want the unheard voices, but do we want to do anything with the unheard voices? Or just, okay, they need bathrooms and power and restrooms and trash cans. Or do we just want to look at the trash they leave everywhere because there's no trash cans? Do we really want to do anything with the voices? So I hope that we might revise the problem statement to reflect the duality we want and also continue with the input from the unheard voices and acting on it. And I realize we can do Northeast at the same time. So if it doesn't have to be sequential, how and when are we going to add to the existing group? And I know that's a bigger question, and I'll be at the bigger group meeting and I'll be bringing it up again, but I feel like it's really important to notice that.
Definitely.
Thank you.
Thank you, Miss Walker. Did you have something you'd like to add? You would, okay.
Ditto.
Awesome. Thank you. All right, we will move on to, thank you both,
Thank you.
Mr. Garcia and Director Oots. We will move on to agenda item 4F, which is a community belonging survey update. So we closed field on the community belonging survey today. I have an update from Professor Bradshaw's of this morning. They were still cleaning data, but they had 759 individuals click on the survey link. That does include people that didn't mean to click on the link, some people that just clicked twice, or some that, got halfway through the survey but didn't complete it. They had 633 individuals finish the survey, and 105 of those individuals were people reporting that they were experiencing homelessness. Professor Bradshaw says that we'll probably lose some of those numbers and anything after data cleaning, but she does believe that we'll close at the 105 people experiencing homelessness, and we'll close somewhere and everything roughly around a 630 plus or minus anything over total respondents. By comparison, we had 552 people take the survey in 2025, and 63 of those individuals were experiencing homelessness. So we were able to increase our representation of people experiencing homelessness in the survey. I just need to recognize Linnell Wilcox. She's been a huge supporter of the community belonging survey from the beginning. She consistently goes out to ensure that we're capturing those voices, and I think it just really goes to show that if engagement is accessible, people will engage, and it's just a matter of being able to take the survey to them. We were able to do some significant outreach this year. There was a press release that I put out in collaboration with the city PIO that was picked up by Salem Reporter and Statesman Journal. The Salem Reporter article drove 200 respondents within a 24-hour window of Salem Reporter driving that story. And then Linnell joined me on KMUZ, I believe it was last Monday or last Tuesday. Melanie Zimmer from KMUZ and Willamette Wake Up hosted us live, and we were able to talk a bit about the survey and through some engagement. And so the students are currently in class right now, analyzing the data and dissecting it. They'll be hard at work for the next couple of weeks, but they'll be coming back to us on June 10th with with a report, their analysis of the findings, then we'll be able to get to work on how we plan on one of the recommendations that we want to try to take to council with that this year, but then also discussing how do we ensure the community belonging survey isn't just a survey that sits on a shelf, because I think over the years, we put in a lot of effort to this community belonging survey, and then it gets distilled down to, 5 to 10 slides and a 5 to 10 minute, presentation to council. And so I encourage all of you guys to think about ways that we can continue telling the story about the results of the community belonging survey beyond just beyond that presentation and, receiving that information here. Are there any questions about the community belonging survey? Seeing none, we'll move on to agenda item 6, staff updates. Thank you. And agenda item 7, any last minute member remarks or announcements? Hearing none, this meeting's adjourned. Thank you. That was fun.
Thank you. Have a good night.